Well, okay. Well, hello, everyone. I'm Beth Johnston. I'm the Chief Community Engagement Officer here at the FSHD Society. And today here with my colleague, Ms. June Kinoshita, our Senior Director of Research and Patient Education, we'd like to welcome you to today's FSHD University webinar. And for those of you who don't know us, the FSHD Society is the world's largest research-focused patient advocacy organization that is focused solely on FSHD. We have over 30 volunteer-led chapters across the US and in Canada. We're part of the 20-plus country World FSHD Alliance, and our mission is to find treatments and a cure for FSHD while empowering you, our families. We offer these FSHD University webinars and so many other amazing educational events to educate and empower everyone affected by FSHD to both become their own best advocate and to advocate for their own health. Today, we are so fortunate to have with us our very own Ms. June Kinoshita. June is our Senior Director of Research and Patient Education, as I mentioned, which means she works at the intersection of research and the FSHD community. One of her very, very, very important roles here is developing educational programs for our community, just like this one today. And June's going to be speaking today about getting trial ready and guiding you through all of the resources to do just that. So without further ado, June, would you like to take the wheel?
I will be happy to do that. So let's see, I'm going to be sharing my screen, but I was curious to know about today's audience. We are going to be talking about getting trial ready, and we have a website, FSHD Society website, which was built to really support all of you and to provide a lot of information about things that we feel are critical for trial readiness. But we realize it's a big website and a lot of nooks and crannies and not always easy to find what you need. People have told me that. So we thought today we'd give you a guided tour and tell you how the different parts of this website contribute to your trial readiness, your empowerment. And so one thing I wanted to ask everybody is how many people have visited the website today? Just raise your hand using the raise your hand function. Great. Beth, do you want to take a count?
So far, we've got 10 folks that have said they visited the website today.
Great. All right, you can put your hands down. How many people may have, who didn't raise their hands just now, have visited this week?
The numbers are going up. Looks like 11 people have said they visited our website this week.
Great. How many people, okay, you can put your hands down. How many people feel they have visited it in the past month?
Ooh, a few more.
Okay.
Looks like 15 people have said they have visited our website in the past month or so.
And then how many have can't remember the last time they visited it? No hurt feelings here. We just want to get a reality check on like.
Well, we've got about 4 folks that say they can't remember the last time that they looked at our website.
Well, for all of you, I'm just going to start with our homepage because there's already quite a lot on there. So, so you can see, like at the very top, we display what we consider like our most important message of the season that we want to get out to you. And of course, this is the end of year. We are in the thick of fundraising because what we raise between now and the end of the year is going to play a big role in determining what we're able to do next year. It's really important. Money is the fuel that drives us, that makes it possible for us to have the incredible team that we have and provide all the programs and fund research initiatives. So that's what you're going to see at the top of the page right now. And if you were to click on this button, it'll tell you kind of what we're doing with your amazingly valuable and important and precious donations. So, but you can scroll down. There's more. There is a whole host of categories of information depending on your interest. If you're interested in the research and how you can contribute to advancing research, that's there. If you want to learn more about FSHD, you click here. If you want to connect with people and build, community, or find fellow advocates, or find fellow patients to talk to, you visit the Build community. And Invest in Hope is really around investing in our community, our organization to drive change. And then there's a little bit about who we are. And you can see we have a lot of accreditations and testimonials and badges from charity watchdog organizations. FSHD University is your gateway to learning about all of these different aspects of living with FSHD, being part of this community. I'll dive into that later. There's a lot in there. And then at the bottom, you'll see some of our latest news. For example, great stuff coming from our Feeling Fit with FSHD program, and news posted yesterday about promising findings from Avidity's myotonic dystrophy trial that's quite relevant to what's going on with FSHD, because Avidity's also using similar technology for their FSHD trial, which is coming up soon. And there's also highlights from upcoming events like today's webinar, and then upcoming Feeling Fit and Care Partner Hour and so on. So if you never scroll to the bottom, it's worth doing because it shows you some important current and ongoing news. You can always also find that by coming to the top of our website. We have all this navigation here. If you go to news, you'll see access to our blog, to the advocate, to the radio, etc. If you go, let's see, calendar is also a good one. That'll show you upcoming events, chapter meetings that are there, and so on. So I am going to actually jump into today's webinar because I have posted there a handout about today's presentations, and you'll be able to find it there later. So first of all, let's talk about trial readiness. And I want to talk about it at two levels. One is at the level of individual, each of you out there. What does it mean for you? And then also we'll later talk about what does it mean as a member of the community? What can you do? Even if you think you'll never actually enroll in a trial, you may be over 65, so you may think you'll never be able to, you've aged out of trial age. But as a member of the community, there's still so much you can do to help our community be trial ready. So at the level of you, the individual, it includes things like having a doctor's diagnosis, having genetic testing, and then being up to date, being informed on the trials that are happening. And there are a number of ways you can do that through the society website, through our newsletters, which you get 2 a month at least from us, beginning of the month and a mid-month newsletter. If you are not getting them, please check your spam folder, because we try to deliver information in there that we feel is important for you to know, that'll be helpful to you, or even very urgent. There's a trial coming, here's how you sign up, etc. There's also clinicaltrials.gov, run by the US, governed by the National Institutes of Health. And another aspect of trial net readiness that's so important is to be in the best health you can be. Unfortunately, not every doctor, not every physical therapist is familiar with FSHD. So you have to be your own best advocate of what is out there, what is known to help you have optimal health. And being in the best health, best well-being also means having the social support, having the community support. So with those things in mind, I'm going to our website. Let me see. Sorry, there we go. So first of all, how do you get a good doctor's diagnosis? One thing we recommend is if you are close to a clinical trial research network site, those are sites where you have doctors with a lot of expertise in FSHD. They not only do research, they also provide care, and they have teams that provide care. So to find that, you go to research, and over here, it says under industry because companies are interested in network, but it's something important for you too. So I want you to know that's where you find the link to the Clinical Trial Research Network, or CTRN. And we have a map showing where these sites are located. All right. And you can zoom in and see, okay, here's the site at Ohio State. And here's the email for the study coordinator there. So if you want to connect with that site, you can just click on that email, contact Marco, tell him, you're wanting to get trial ready and you'd like to be in touch with the neurologist there, or maybe you haven't been to a neurologist in years and you want to get yourself up to date and be seen there. That would be a great way to go about doing it. All right. And down here, we have profiles of the trial coordinators, the people that you'll be interfacing with, dealing with directly if you were to go to that site, say, to participate in a trial. And there are other links down here. You can go to the CTRN website directly to find out more about that. We also list the sites down here if you're not into the map kind of thing. All right. So that's one way if you are living close to one of these sites or have a relative you can visit and make an annual trip there or whatever. CTRNs are an excellent way to get connected into the infrastructure of clinical care, best clinical care and research in the country. But of course, there are other great doctors out there. And so if you are not in a position to go to a CTRN site, just contact us. Use the contact link. You can always find that at the very foot of our website. Let's see. Where's the contact link? It moved. Oh, there it is. Contact us at the very, very bottom of the footer. Click on that. Send us an email saying you are looking for a good neurologist or physical therapist. And we will see what we can do. We know people all over the country. We can't guarantee there'll be someone near you, but we'll do our best to find somebody. We can't guarantee that that person will be somebody that you'll click with and love, because it's such a personal thing, your relationship with a doctor, but we'll do our best to help you. Okay. And then the other challenge you all have is that your doctors don't always know a lot about FSHD. Maybe you have a primary care physician you love, they just don't know much about FSHD, or maybe you have a neurologist and they, just have never seen too many FSHD patients. You could suggest to them that they think about taking our FSHD masterclass, which gives education for physicians and physical therapists and other medical professionals, education, training about FSHD. So that is also under the research tab here. This column here for clinicians, you'll see there the FSHD masterclass. And the reason doctors might be interested is that they can, if they take this class by clicking on this link, you send them this page and send them the link, they can earn professional credits that they need to earn, a certain amount of every few years in order to maintain their license to practice. So they will appreciate hearing about this opportunity to earn some credits and also advance their knowledge of FSHD. All right, so the second thing I mentioned is if you have not had a genetic test and you are thinking you might want to participate in a clinical trial, it's a good idea to think about getting one now or in advance, because genetic testing can take, from start to finish, it can take 8 to 12 weeks. And if you wait until a trial starts recruiting and then go like, okay, now I've got to get my genetic test, you may miss the window of time in which they are recruiting patients. So, so there is under Understanding FSHD, a link to learn about genetic testing. It's not a small decision because it impacts your family. It's a genetic disease. So if you find out for sure you have FSHD, it means that family members may be at risk and they might need to have a conversation about whether they should consider getting testing or not. And the best way to make that decision really is to speak with a genetic counselor who's knowledgeable about FSHD. So we have an FAQ here about genetic testing with genetic counselor Julie Cohen. That might answer a lot of the questions you have. And then we also list down here the different labs in the US and abroad that offer FSHD genetic testing. And we have links to their websites and information about well, if you go there, you'll find out like how much it costs and so on. So that's a resource for you and your doctor to find out about where to get genetic testing. And then very importantly, we started a program this year called Test FSHD that makes it easier to navigate this whole genetic testing landscape. So as many of you may know that we had a pilot program where we had sponsors cover the cost for up to 150 individuals to get FSHD testing. And many of you responded, and we got 150 people tested. The funding for that program has been used up, so the pilot program is over, but what stays in place is the pathway that we established to make it very straightforward and easy for you or your doctor to get you tested. So that is here, and I think fairly soon we're going to open this portal up again. It starts with contacting Genome Medical, which is a company that provides telemedicine, genetic counseling over a Zoom or Skype or something. And they will provide counseling for you. And then if they determine that you are a candidate to get the testing, they will help arrange for you to get the blood draw and then have the paperwork to get your blood sample sent to one of the labs that conducts testing. They will help you. Right now, it would be paid either directly by you or by your insurance, and they will help you navigate all that stuff around payment and filing insurance claims and so on. So that is another important part of trial readiness, which is genetic testing. And then being up to date on trials. We have resources for that as well. So under research, all over, or actually another place, Get Involved is a good place to go. There is, under advancing research, clinical trials. And here you will find information about what is a clinical trial, what is a study, what's a trial, what's the difference. If you want to learn more, there is a link here. What is a clinical trial? That explains that it's a scientific experiment. It explains what the different phases are, what happens at each phase, how many people are usually needed at those phases, at what point does a drug come up to the FDA for approval, et cetera. And we have all these frequently asked questions about clinical trials down here, right? And if you go back, how do I navigate back? There we go. Going back to the main clinical trial page, we list many of the current clinical trials. So we have a trial here from Fulcrum that explains, it has a link to the full trial protocol, that that would be at clinicaltrials.gov. And then some questions, frequently asked questions about the trial. And then we have not yet recruiting the Fortitude trial from Avidity Biosciences and the Maneuver trial from Roche. And as we get more information about that, we'll be updating these pages to explain what's involved with those trials, how to sign up, and so on. Of course, clinical trials are not the end-all and be-all. These additional research studies are so important. They are part of trial readiness because studies like the MOVE natural history trial, future FSHD trials are going to be built on the data that you as a participant contribute to the MOVE study. And this is so, so important because if we don't have good data on how FSHD develops across a population of patients, future trial data will be very difficult to interpret, very difficult to do a really ironclad trial. So, that's an important study. There are other, you can go through there. So if you have this inclination to contribute through participating in research, you'll find it all on this page, okay? And then I mentioned also being in the best health you can be, optimizing your health. And a great place to go for that is here under Understanding FSHD. All the way up on the right is FSHD University. So we call this your Center for Education about the Art and Science of Living with FSHD. And it is indeed, some of it is a science, but some of it is still an art. And it is taught by all types of experts in FSHD, and not just the, Dr. Statland and Dr. Tawil and the MDs and PhDs, but those of you who have, we say, earned your virtual MDs and PhDs because living with FSHD, you are an expert. And so we have created forums where you and others can share your expertise with the community. And it's so valuable. We learn so much from it. Your fellow patients learn so much from it. So when you come to this page, you're going to see the calendar of upcoming events. So for example, in January, we're going to have a webinar about the Fortitude trial. So some folks from Avidity will be there to present that webinar. And then in February, you're going to have an update on stem cell research from Rita Perlinguero. So this is where you can come to see at a glance what's coming up in the webinars. And then we have these departments. We call them departments of physical health, wellness, and research. So physical health is where you can learn more about two aspects. One is sort of health and medical aspects of FSHD. And we have all these resources around how to find care, health tips. We have a library of brochures and documents like the About FSHD or the physical therapy brochure and so on. And then we have descriptions of aspects, medical aspects of FSHD, like physical therapy, occupational assistive therapy, pain management, etc. So things you might not even thought about, like anesthesia, that what do you need to think about if you're going to have surgery, or what's known about heart health. So that's all here under the physical, the health and medicine section of physical health. And there are our videos, our video library from our YouTube channel. I have a lot of material here. So this is where you find all that. And if you go, there's no back button here. Okay, that's. And then there's another section to physical health, which is exercise and fitness. And if you go there, you will get all our videos, blog posts around fitness. So we're doing this wonderful series right now with Frank Hanley through Feeling Fit with FSHD. Frank is a Qigong master who has FSHD, And he has designed a series of exercises that can be done from a sitting position. If you are, not, if you're not strong on your legs, you can do them from sitting position. And they are in real time. You just sit there and go through these exercises with Frank, and then you can watch the videos and do them on your own time. So that's terrific. And then we have blog posts about these. So these blog posts include the videos as well as handouts that he's prepared for you. And then other people have done similar, David Younger's exercise arsenal or dynamic sitting. This is from Nikia Stinson at Kennedy Krieger. So that's where you find a ton of information about exercise and fitness. And then we go to wellness. So we think of wellness as more holistic mental health and social health, social well-being, and so on. So there you can find links to our gathering places, which are Zoom communities that offer camaraderie and information and support around a variety of interest areas. And you'll find videos addressing topics of mental health and wellness. This is an amazing video, The Reinventor, with Amy Beckier, who's on our board and very active in helping provide education and support and advocacy out in San Diego. She was the subject of an amazing short documentary where she talks about how, with living with FSHD, she has realized she's had to reinvent herself every few years. And she talks about this with such a wonderful sense of humor. I think many of you will relate to it. And it's a very, uplifting but real account of living with FSHD. So if you haven't had a chance to watch it, I highly recommend it. It's starting to win all kinds of awards at film festivals, including a recent international, Best Short Documentary Award. So check that out. And then another aspect of optimizing your health is to just stay up on research. So the research it's not all test tubes and mice, it's also deepening our understanding of FSHD. So recent one around that was, let's see, I'm not seeing it here right away, but we had the webinar a couple of months ago on bowel and urinary health and so on. And before that, there was one on sleep and so on. So these will be available on our YouTube channel, and you can also find them on the research page. All right. And then another super important aspect of well-being is social connection. And under the Get Involved tab here, there's a section called Connect. And we really fervently believe no one should ever have to face FSHD alone. You may want to, and that's totally up to you, but so many people tell us at meetings like, wow, this is the first time I've met others and it's life-changing. And we can make that happen to you right through our website. So we have a chapter program. There are over 30 of them, as Beth said earlier. And you can just browse through this to see if there's a chapter near you. And I will also say most of the chapters in the post-COVID era have virtual meetings. So even if you don't live near a chapter, you can find your community through one of these chapters. And sometimes it's a matter of just like clicking with the person who runs that chapter, and they're going to become your best friend and all that. So, and we also have so many online communities. Now we call them the Gathering Place, and we have every month these meet at different times. So we have the Wellness Hour, We have care partners for family members who don't have FSHD but are part of your care circle, and they need support too, and they need information so they can meet with other spouses or parents or children, to just talk about the things that they, and share information that helps them. We have a roundtable for parents of children who have early onset FSHD, and that's a really, I would say, real change maker group. Still small, hoping to build, because we really need strong advocacy for pediatric patients with FSHD. They have traditionally been a bit overlooked, and now just only in the last few years we've really pushed for children to be included in natural history studies, and to start thinking about trial readiness for pediatric individuals. Women on Wellness is for women, as it says, and that's an incredibly dynamic, well-run group. And then Feeling Fit is dedicated to doing, to exercise and physical fitness. And then we also have our podcast, which is terrific, which profiles movers and shakers in our field. And it's a wonderful sense also of community, of being connected when you listen to the podcasts. We also have all our different social media groups. I would say most active in terms of having communities, having groups get together, are the Facebook communities and groups. And we have growing Instagram groups where, especially for Gen Zs, there's a growing, really nice group called Gen Z of FSHD. The YouTube channel is more for, we have a lot of subscribers. It's really for people who are looking for video, YouTube information. And Twitter is kind of more of a news stream, I would say, and sharing news over Twitter. So I think that's a lot for you to absorb. As I said, this handout is available on the website. So what I've just gone through with you is all summarized here with links, so you don't have to keep everything in memory. All right. And then we come to the community. So even if you aren't in a clinical trial or don't consider ever joining one, you are still an important part of trial readiness at the community level. So if you read the news, you know what's going on, so you can tell others. If you have family members or friends you've made through the FSHD communities, be someone who can be an advocate, who can help educate others. Be present. So if you do live near a CTRN site, if you get to know them, the more people that the researchers and doctors at the CTRN get to know who have FSHD, it gives them a boost. It helps them feel like, okay, these are the people we're serving. Just getting that in-person connection makes a big difference. And so, it might be through that you're reaching out to them to become a patient there, or it might be coming to the 360 meetings that we have. I didn't even mention 360s, but we organize about 3 or 4 of them every year, centered on different CTRN sites. And that's a great, informal way to just mingle, get to know people at the CTRN site. As I said, tell your doctor and physical therapist about what's going on with clinical trials, about the FSHD masterclass, because you never know what other FSHD person's going to walk through their door and seek care with them. So, you can be an advocate and a conduit for your medical, the professionals that you deal with. As I said, share this information with family members and friends. Share your FSHD journey through testimony and surveys like the Voice of the Patient Forum, all the survey studies that we send out. Your experience just adds so importantly to the knowledge base that is going to shape the future for our community. And then support the community, help raise awareness, raise funding, raise friends. And a great way to do that is through the Walk and Roll. That's our flagship international event. And it's about so much more than just fundraising. It is about raising awareness, both locally and globally. It's about sharing your story. It's about connecting with others. And very importantly, of course, it's also about raising the resources that we need to do this work that we do. So that is, I think I'm going to end with just, here's who we are. And if you do want to share who we are with people you know, your company or people you know who might be in a position to help us, or just who want to know more about us in order to get involved. It's all here. We provide our history, our mission there, and I think very importantly, our team. And we just have an amazing team. I feel incredibly privileged to work with these wonderful, dedicated people. And I want you to see who they are, know how to find out who they are. They are all here. They're real people. We're working here every day. We have your back. And in case you never looked at that part of their website, I felt that was worth highlighting that. And I'm going to pause here and open up for questions.
I hate that picture of me on the website, but that's okay, June. You had to show it.
Sorry.
We do have some questions. Again, if you have a question for June, please type it in the Q&A section of the Zoom. You can find the button at the bottom of my screen anyway. It's at the bottom and it just says Q&A. So if you'd like to ask a question, please type it in the Q&A. We do have one comment from Ken, who recently attended a chapter meeting at Avidity's lab, actually. I think it was about a week ago. And he mentions that they were talking about most of the trials aren't available for folks over the age of 65. And there was some discussion around building a cohort study for people who are 55 and over to be incorporated in some of the trials. So that was just a comment from Ken, which is a very interesting comment. So there is a question here that says, some trials involve a muscle biopsy. Can you please explain what that entails and if it's painful?
So I can't speak for all of the trials because I don't know the exact protocol for muscle biopsy, but it's certainly something you can ask about. So the Fulcrum trial, phase 2, for example, they did a muscle biopsy that involved a needle. So kind of a thick needle, but under anesthesia, they go in it and they grab a piece of muscle about the size of a grain of rice. And people who've had it say like it was not really a big deal. But of course, everybody has a different experience. But that's called a needle biopsy. It would be the least invasive type of biopsy. And they have to do it because that's really the only way to know if the drug is hitting the DUX4 gene target. There are other biopsies that people used to do. I hope they don't do it very much anymore, but they used to it used to be a surgery where they just kind of cut open your arm and take out a fair-sized chunk of tissue, and then they stitch it up, and that's a lot more invasive and can be painful in the recovery. I don't know of any trial that requires that type of biopsy right now, but it's a good question to ask if you're interested in. It's like, is there a biopsy? And if so, please describe the procedure.
And Hillary put her email address in the chat. If anyone, she had a muscle biopsy as part of a trial, and she's happy to share her experiences with everyone. So if you're curious about it, if you're scared about it, if you just want to know more about it, Hillary has graciously offered her email address. So contact her to learn more about her experience with muscle biopsy. And just a comment from Gail saying, June, thanks for this. Navigating the website has been very helpful because there is so much information on our website, and even I get lost on it. And so, we're in it all the time. So just navigating through that was really, really helpful. And let's see, there is a question from Zach, and I don't know if we can answer this one, but maybe you want to speak to it. Zach says, can you indicate your expectations regarding the timeline to a meaningful treatment for FSHD?
Okay, so this is a little bit like looking into a crystal ball, but there's some facts and some reasonable speculation we can base it on. So, so the first, the lead horse out of the gate is losmapimod, which is being developed by Fulcrum Therapeutics. So it is, in a phase 3 trial now. Not every site has activated yet, which means they're not quite ready to start screening patients and start putting them into the trial. It's an enormously complicated endeavor. So it takes a bit of time, but there are probably about 5 or 6 sites now in the US that are starting to recruit. If you go to the clinicaltrials.gov site and look under locations, you will see the ones that say are active or recruiting. But it is probably going to, so the trial itself, the drug is administered for 48 weeks, I believe. And there's a period before that where you're assessed, and, like a month before that, they do assessment. And then there's like an after the 48-week period, there's another bunch of assessment, maybe. So the entire span of that is about 53 weeks, if all goes well and there are no delays. So here's the thing, is that the trial needs to recruit 230 individuals. And it's only when the 230th person has enrolled that 53-week clock really starts running, because until you have the data from the last person in, you haven't finished the trial, right? So there are a number of factors, like, can all these 30 sites jump through all the bureaucratic hoops and legal and all the stuff they need to do to get the trial up and active? And some of them, it might take them another months and so on. Once they've started it, they might be able to screen only 2 or 3 patients every month, because the screening process can take a whole day and involve a half dozen people who each come in, and one of them administers a questionnaire, someone else takes your blood pressure, and your height and weight, and someone else needs to do the MRI, and time on the MRI is very limited. It's just, I've been through a clinical trial and I really appreciated what was involved. You have to, how hard it is to just get one doctor's appointment. Well, now you've got to get 5 or 6 people who all have time on the same day to see you. So, and they're also running trials for other diseases, ALS and SMA and Duchenne. So there's that. That's a limiting factor. How fast can each site, screen and enroll people? And as I said, they've got to do this for 230 patients around the world. We have 30 sites active, so each site might be 4 or 5 people, and then maybe we'll get there. But it's only when the last patient enrolls that clock starts running. So it might be, if things go amazingly well, maybe a year and a half from now, maybe they'll have all the data, but it might be longer. It might be 2 years. It might be beyond that. And then once the data is all collected, they've got to sit down and, okay, they now unblind it for the first time. They know, here's a group of data from people who are taking the pill. Here's the people who were on the placebo. And let's look at all the different things we measured in all of them. And was there a difference in this group taking the drug versus the placebo group? That analysis, believe me, they're going to be 24/7 working on this, and it'll still take them many months. And it's got to be reviewed and airtight, and And when they are ready, they will put together a packet that they go to the FDA. And putting that packet together, I've never done it myself, but I can only imagine. Beth and I once applied for an NIH grant. That was a multi-month process just to fill out that paperwork.
Yes.
So, with all the resources they have, it might take them, well, let's see. I think it took Fulcrum from the phase 2 trial to get in front and then have the data ready to get in front of the FDA and then get a hearing with the FDA and then get an approval to do the phase 3 was close to a year. So I would say might be about that long before they get in front of the FDA for an approval. So we're talking anywhere from 2.5 to 3 years from now. And we will be sweating because we have
We have a deadline,
we want to
2025.
see
Good.
something,
Yeah.
but that's so I hope that gives you an idea of what's involved and why, it might seem to be a snail's pace for you, but believe me, hundreds of people are paddling frantically under the surface of the water.
Like a duck on top of the water is going smoothly, but you don't see his little legs going 100 miles a minute underneath the water. So yeah, that's good. There was a second part to that question, actually, June, that maybe you can speak to, in that he or our anonymous attendee says, can we afford to take a drug if one becomes available? And maybe you can talk about the wonderful survey that we did that so many of us participated in, called the Health Economics Survey, or the True Cost of FSHD. So maybe you can talk a little bit about how important that survey is to actually determining how much a drug will cost.
Yes. Okay. So I will say at the outset that one reason pharmaceutical companies have started developing rare disease drugs, and this is a big change because it used to be like if there was no big market for a drug, like you didn't have a hope of it because it costs, the investment by the company is enormous, like 100 million on average, and it's probably going up because prices are not going down, prices are going up. So they need to be able to, make that back somehow, right? And the only way really they can do that is through charging for the therapy that they develop. And they have some protections to make them, they have more, like they can have an exclusive right to that drug longer than a typical drug for bigger, et cetera. But they are counting on the insurance companies to come through and cover the cost of the drug. And then sometimes, hospitals and so on have philanthropies and to kind of make drugs and treatments available that cover the cost for people who don't have insurance and so on. So we have this patchwork mechanism to cover the cost of medical treatment in our country. So the reason we have done this survey, the true cost of FSHD, and we're doing a lot right now in what we call health economics, is that there's not a good understanding right now of what it costs to live with FSHD in the United States, and certainly in other countries, but every country has its own differences economically. So we have to study each country one at a time. In the US, this is the first comprehensive study like that's ever been done. And the reason we're doing it is we need to speak into that discussion of drug pricing that's going to be happening in a few years. And we need to be able to say, this is what it costs if there's no treatment. So, Medicare should reimburse because, there's going to be a net benefit to society for people to be treated, for their symptoms to be slowed down or reversed, et cetera. So we are trying to get at what would be, not just like what is the highest amount any company can charge, and but really what is fair? What's fair given what it costs to live with FSHD? And and I think we all know that it's much more than just what insurance payers are paying now to cover your treatments, because without treatment, like some of you are not even going to the doctor at all, so there's no data, and then many of you are paying out of pocket for devices and home adaptations and supplements and physical therapy and massages and whatever it is it takes for you to be able to manage living with FSHD. So we want all of that to be factored into the conversation around fair pricing.
So there's a lot that goes into it's a simple question, how much is it going to cost? But the actual what goes into determining how much it's going to cost is really, really a lot. This is probably, we'll do this as our last question, but it's an important one because I think a lot of our community is experiencing the same issue. And Sandra says she's enrolled in the trial, but she's been waiting a while to get an initial appointment with her trial site. So she's just wondering if other people are experiencing this long waiting period. Maybe what are some of the reasons that they're not able to get people in until the spring? Could you address maybe some of those issues for us, June?
Sure. Yeah. No, we've been hearing that a lot, and I hope what I said earlier about just how complicated it is to even set up a screening visit is a big reason why it takes as long as it does to even just get on the calendar. And even for the site study coordinator to get back to you to schedule it is very complicated. I am trusting that they do actually have your name on their list and they're working their way through. There are other people on the list ahead of you, perhaps. There's, if you're anxious, I always check on things like that just to make sure that you didn't fall through the cracks and that you are on the list. And I think, study coordinators would be happy to just put your mind at ease, that yes, we'll get to you. But as I said, they have to line up multiple people to all on the same day be able to see you in as efficient a way as they can manage. And sometimes these MRIs are booked. They're used for other things. They're used for, all the cancer patients and the, surgery patients, and, just have to get in line. And so everybody needs to be patient and try to do your part to help move this very cumbersome multi-part beast forward.
I agree. Actually, there is one more question that's pretty appropriate, and then we'll have to cut it off for the day. But Sarah's asking about one of the biopharmas that we talked about in our latest Advocate magazine was Epic Bio, and she is curious about if that technology that they're using, the CRISPR technology, does it have to go through the same process that all these other drug companies do as far as the FDA approval and things like that?
Yes. Every company needs to go through kind of the same process, and Epic Bio at this point is still looking around for what we call their lead drug, the one that they feel is a good candidate to actually put into patients. So they're still doing all this basic research. And once they do that, they need to then go to the FDA to get permission to be able to start a clinical trial, to start testing in people. And they have to go through the phase 1, phase 2, phase 3. And in some ways, the bar will be higher for companies like Epic that are doing totally new technology, because if it's never been put into a person before, you've got to be super careful. You start with a healthy college student or somebody, and make sure it doesn't cause any huge allergic reactions or other reactions, and then and so on. One reason losmapimod got going as fast as it did, even if it feels glacial to you, it was like for us lightning speed. Seeing how is that losmapimod was actually tested in clinical trials for a totally unrelated condition, heart disease, I think, and maybe lung issues. So it went through safety testing in several thousand people. And so they didn't have to go through that same level of safety testing in order to start their trial. But some of these new drugs that, they sound so exciting, will need to be, approached with a lot more caution. The news actually I pointed to with Avidity, that was really great news because they are the first company out there developing what's called an RNA-based therapy. So RNA is related to DNA. It's like the single DNA is the double helix. If you pull them apart and take a little piece of it, that's kind of basically like RNA. You reuse that to actually, it's like a lock and key. It can identify the DUX4 RNA that's out there and it's about to go off and make DUX4 protein and do all sorts of bad things. This RNA therapy can find that DUX4 RNA before it can do any damage and glom onto it and just make sure it gets destroyed, got rid of. So it's very targeted. You can't get more targeted than that. But it has, it's new, and they developed a way to get it into your muscles. And the first trial they did was in myotonic dystrophy using a different gene target, so different little oligonucleotide. And what they showed is that actually works. It's never been put into a human being with a muscle disease, and they showed that it gets into the muscle, it squashes down the gene that's involved in myotonic dystrophy, reduced its expression by about 45%, and seems to not have any serious, adverse effects. So that's really encouraging for us because all they need to do is the same truck, different cargo to treat FSHD. So that was exciting news worth reporting on.
Very, very exciting. Thank you. Well, June, I think that's all the questions we have time for today. Thank you so much for coming and for presenting. You're one of our local experts and one of our local superheroes, and we are so proud and happy and thankful that you're on our team. You are on our side. We should be very lucky as an FSHD community to have June Kinoshita on our side.
Oh, well. Feel the same way about you, Beth, and everybody on our team. It really is a team effort, and I hope, if nothing else, I hope everybody listening out there feels the strength of the team that we have. That we're here working for you. We're dedicated. We love you. We've met. We're friends with so many of you now. So we're and. Some of you you get emails from us in the middle of the night. This is a passion project. It's not just a job.
Exactly. I want to thank everyone for attending our FSHD University webinar today. Again, special thank you to June for showing us around. And I hope that everyone feels better armed and ready to do your part when it comes to clinical trials for FSHD. We're going to reboot our FSHD University series in the new year. As June mentioned, on January 19th, we're going to have guest speakers from Avidity Biosciences, who's going to talk about launching their phase 1/2 clinical trial for, it's called Fortitude. And there were a lot of questions in the chat and in the Q&A about this trial. I encourage you on January 19th to come to our webinar. Avidity will be our guest speakers, and they will be talking specifically about this trial. So also just be sure to visit our website and events calendar for all the upcoming chapter wellness educational events. It's all there. So thank you again for joining us today. We wish everyone a very restful holiday season and a happy, happy new year. See everyone next year. Bye-bye.